Hi, Hadley.
Hi, IJ.
I'm a ward manager and a registered nurse at Homerton Hospital. I wonder if you could tell me more about call for concern and what it is.
Of course, IJ. So I'm one of the CCOT nurses. Call for concern is a way inpatients or their relatives can escalate their concerns directly to us, the critical care outreach team. If they think the patient is acutely unwell or deteriorating and concerned about what is happening, they can call CCOT on the call for concern mobile, which is 0755 715 7464. We will then review the patient and liaise with the team looking after them about the situation.
That sounds really great. But wouldn't the team looking after them already know what's happening?
Yes, but call for concern is activated when the patient or their relatives are concerned about clinical deterioration despite this.
Okay.
They know the patient best and they can tell when something isn't quite right. If the ward team have already tried to address this, but the patient is still worried, we are able to provide a fresh pair of eyes to assess the situation and check in with the team that everyone is on the same page. That way, we can work together and move forwards.
Okay. Would patients be able to call CCOT at any time of the day?
Yes, we operate call for concern 24 hours a day, 7 days a week. It is for all patients admitted to the hospital, including neonatal, pediatric, adult, and maternity patients. It is not for outpatients. Patients and relatives call via mobile and can get straight through to us. If we are occupied with a clinical task, we may not always be able to answer the phone straight away. There is a voicemail explaining that we are sorry that we can't take the call and to leave a message with their details and a contact number. We will get back to them as soon as we can.
I see. Sounds really like a great service. Are Homerton the only hospital running it?
We're not the only ones. It is now an NHS England mandate, so hospitals up and down the country will be rolling it out. There are some hospitals who have been running this for many years, and we know a lot of information from them already. We know call for concern can help by addressing a gap in what patients or relatives understand. For example, we can explain how a ward or hospital runs, explain reasons for scans and tests, and make sure that patients are being communicated to clearly and by the right people.
It sounds like it will help alleviate a lot of people's worries. Aren't you going to be inundated with calls?
Well, we won't know exactly how many calls to expect until we run it. But from the longest call for concern centres in the UK, which are twice as big as Homerton, we know that they average 6 calls a month over 7 years, and that the call for concern calls were less than 1% of all CCOT calls.
Okay.
We'll keep a record of what kind of calls come through and what happened to those patients. I suppose it's important to say this service is used to raise clinical concerns about acute deterioration and isn't a complaints line.
Right.
There are many ways that non-clinical issues can be raised. For example, call for concern is not to be used for issues around parking, food, appointments, visitation or waiting times. We will redirect those calls to the appropriate people, like the nurse in charge, the ward manager, PALS, or the complaints team.
Okay. How can ward staff like me, nurses, doctors, and allied health professionals help or be involved?
It would be helpful if everyone is aware of what call for concern is and to guide patients and their families to our mobile number if they want to get in touch with us. There will be posters and leaflets all around the wards. The patient leaflet will have a QR code leading to the Call for Concern website. And staff can also access this for more information or via the intranet. Of course, we should always make sure that we are all doing our part in hearing the patient's voice. If a patient or relative tells you that they are scared or worried or concerned, take it seriously and let the medical team know. They may be upset, angry, distressed, or withdrawn. These are all signs that they may be concerned about something.
Yeah.
If, despite your efforts, your patient escalates to call for concern, don't be disheartened and don't take it personally. Sometimes it is easier to speak to a third party rather than the person looking after you every day.
So,
Mm.
what about those that don't speak English or can't speak at all, or those who don't have relatives visiting?
The patient leaflet is translated into several different languages on the Call for Concern website. For those who can't advocate for themselves through speech or don't have relatives, it is up to us individually to advocate for those patients. We will be doing it anyway when all members of the team see how patients are and communicate with them. It is rare, but staff can call for concern on the patient's behalf too.
Okay, so what are your thoughts about call for concern as the CCOT team?
I think it's a great opportunity to hear the patient's voice and to improve our monitoring of deteriorating patients across the hospital. I think Call for Concern will do that. Whatever challenges that come up, we have a fantastic team to deal with them and learn from what arises.
That's great. Thank you so much for explaining call for concern, Hadley. I'm really looking forward to hearing about the ways we can improve patient care.